Well, good afternoon, everybody, and welcome. I'm Susie Barragate. I'm President and CEO of Vocational Guidance Services. Thank you so much for joining our first virtual learning series. The new initiative is designed to help the community understand developmental disabilities and share ways that we can collectively support individuals with disabilities. Together, we will examine the continued impact of COVID-19 and help Northeast Ohio move towards greater workforce equity and disability inclusion. March happens to be Developmental Disabilities Awareness Month, and it's the perfect time to launch our learning series. This month raises awareness about the inclusion of people with developmental disabilities in all areas of community life, as well as awareness of the barriers that people with disabilities face in connecting to the communities in which they live. I'm joined today by Kelly Petty, Superintendent of the Cuyahoga County Board of Developmental Disabilities. Kelly has been the Superintendent and CEO of the County Board since 2013. The County Board provides services to individuals with developmental disabilities of all ages, including early intervention, youth transition services, and housing supports. Kelly, welcome.
Thank you. It's a pleasure to be here.
I'm also joined by my colleague, Laura Lamb, Chief Operating Officer at Vocational Guidance Services. Laura has been at VGS since 1998. As COO, she oversees the agency's vocational rehabilitation programs. Thanks for joining me, Laura.
Hi, I'm happy to be a part of this discussion. Thank you.
For our format today, Kelly and Laura will answer a few questions about COVID-19, vaccination efforts, and what is next for developmental disability services. We will then open it up to the audience for any questions or comments. Throughout our conversation, feel free to submit a question using the chat box or the Q&A feature, and I encourage all of you to share with us. So let's begin with a few key statistics. More than 1 in 4 of today's 20-year-olds will experience a disability before they are retired. As we know, COVID-19 has pushed the world into a new digital era in which we're using the internet more than ever for connecting with family and friends. However, at least 1.3 billion people have a disability that prevents them from fully accessing content on the internet. Nearly 40% of people with disabilities were laid off because of the COVID-19 pandemic, and people with disabilities are disproportionately employed in industries that were impacted by the pandemic. And I know that it's still hard to believe that we've been living with this COVID-19 pandemic for 1 year. This time last year, Ohioans were under a statewide stay-at-home order issued by the Department of Health and Governor DeWine, with schools abruptly shifting to virtual learning and businesses closing their doors. 1 year later, we're still grappling with the effects. So Kelly, can you tell us a bit about how the initial mandate affected developmental disability services?
Yes, thank you. Thank you again for having me here today. So when the stay-at-home order was first issued just about a year ago, we, of course, quickly had to move to virtual services as opposed to in-person services. So we immediately ceased doing home visits or any kind of in-person visits with individuals and families. Unless there was an emergency situation. We did have a mechanism for staff to obtain permission if they believed there was some kind of an emergency situation requiring them to see someone. Fortunately, we had been what I would say called dabbling in doing virtual visits with families and using Zoom for different kinds of meetings. And we also had fortunately upgraded a lot of our equipment in February of 2020. And so we were pretty easily able to expand the use of those things so that we could continue to support people in a virtual fashion. In addition to that, we also did, in the early weeks of that stay-at-home order, we reached out by phone to every single person, all 10,000 or so individuals that are actively eligible for our services, and just touched base with them, made sure that they were okay, asked if they had any questions. And most importantly, we made sure that they knew how to reach us in the event that they had a need, because a lot of those 10,000 people, we don't necessarily have a lot of regular contact with during typical times. So we were able to do that. We also immediately started gathering up our supplies, our PPE and our cleaning supplies. We, again, fortunately, we had at least one really good stash of what we called a pandemic supply closet that we put together a few years ago, back when different strains of flus, and there was fear that one of those strains could turn into a pandemic. And so we had a fairly significant amount of PPE and cleaning supplies, but it, as we know, it didn't end up lasting. But we gathered that all into a central location so that we could begin distributing it. And we also initiated some regular and frequent communication with our provider community here in Cuyahoga County so that we could hear from all of you of what your needs were. We implemented a portal on our website related to staffing needs. We, of course, distributed the PPE that we had to all of you and just helped with coordinating and disseminating the lots and lots of information coming out of Columbus related to the pandemic and things that you would need to know about changes to rules so that you could more effectively serve people, and as well as limitations that were placed on providers. So we were we were very busy back then. When I was thinking about this question, it feels like longer than a year ago in some ways, but in some ways it's hard to believe that it was a whole year ago. There was lots of activity in those early days. We also worked with our boards of health and our local EMA. We established regular contact with them, and we got some funding approved by our board that we could make available to providers. And we developed some what we called relocation or isolation sites should they become necessary for people who would test positive for COVID. And back then we also had lots and lots of discussions about testing. So now now there's lots of talk about vaccine. A year ago it was testing. Many providers were really struggling with and families with how to access testing. It was very difficult, if you remember, in those early days. And so lots of contact with the boards of health about how can we make easier, faster access to testing.
So as we think about it now, and we've sort of moved beyond the concern about having enough PPE or having enough testing capability, and we're sort of hearing new guidelines about social distancing coming from the CDC, particularly in schools. Where do you think that leaves us now in terms of the number of people that we're able to serve or the capacity that the community can serve?
Well, I know that fairly recently there was an expansion for day providers to serve 12 people in a group. Beyond that, I'm not aware of anything coming down the pike specifically to change or increase that, but I do know that there are discussions taking place around that. I personally have not been a part of those discussions down at the state level, but I wouldn't be surprised if we don't start hearing before too long that there is an effort being made to loosen up some of those restrictions further so that providers could serve larger groups of people again. But unfortunately, I don't have anything specific today.
So Laura, maybe you can give us just a little bit of information about what it looked like from a provider's viewpoint, thinking back a year ago and what we went through with the programming. What did that look like?
Absolutely. And Kelly, when you said it's hard to believe it was a year ago, I would agree. I think in some cases it's like, wow, it's been a year. And in some cases it feels just like yesterday. So for us at Vocational Guidance Services, I think there was a period of time from March till July that we suspended services, due to the health orders and just the uncertainties of what would program look like. We paused those services. like the county board, we additionally reached out to each and every participant just to check in. What were their needs? How were they doing? So that was definitely a large undertaking to reach out to the nearly 500 individuals that we serve at that time. And I think for us, those weekly calls or those bi-weekly calls from the county board and other partners were invaluable in terms of the information and resources that were provided. One, it helped us remember that we weren't in it alone, but it also gave us great resources about, as you said, testing, PPE, where to, potentially acquire some of that PPE as well. So I will say, with the coordination of the county board, the providers really kind of came together and really just supported one another and the individuals in the community itself. So that was really, really helpful. I think once some orders and the assurance forms that came out from the Department of Developmental Disabilities for us to kind of relaunch our services, once that started, I think that real deep dive into, okay, can we provide social distancing? What is our capacity? Do we have enough sanitation, masks? All of that came into play. And for us, it's really helpful for us to have, again, that resource from the partnering calls, but it's definitely different, and it has been different. For us, serving close to 500 individuals pre-pandemic to where we are now with just over about 150 individuals. So that's definitely a stark difference of where we were to where we are. But, our staff, I would have to say, really jumped in to keep individuals safe. Those pods, and we're following all the guidelines to make sure that when an individual does come in, they are in a pod, they are safe, they are following the social distancing, the masking guidelines. We have instituted daily temperature checks and almost hourly hand washing. It's almost like, okay, let's pause and head to the areas to wash. So it's definitely different from where it is. In addition, the community integration piece of allowing our individuals to be a part of the community, that's been very different. Everybody has been stay at home, stay at your center, stay, safe. And we've done a lot of reverse integration. And I know the county board has also been a part of that, but really trying to keep our individuals engaged and bringing new opportunities to them in their programming, Tai Chi and yoga and interviewing and just gaming. There's been a lot of opportunities to think outside the box to continue to provide those services, but we really had to be creative and kind of think differently. And it's been great to have a partner like the county board along with us.
So as we look towards, full reopening and all of that, we've been talking about vaccinations. And certainly Ohio and Cleveland's efforts to get vaccinated. And we know that it's been reported that people with intellectual disabilities are 6 times more likely to die if they contract COVID-19. They were among the first to have access to vaccines in the phase 1B that came out. But Kelly, from your perspective, what's been the response? Do we need additional education for both the participants and the direct service providers? How do you feel that's working for the individuals that we serve?
So yes, and just to reiterate that the governor did make people with developmental disabilities a priority for the vaccine because he felt it was important that anyone who was at the greatest risk of a serious outcome should they contract COVID-19 should be prioritized for the vaccines. And so, yes, we had, I would describe it as a very good response to the vaccine so far. And even before Group 1B, we had Group 1A, which was individuals living in congregate care settings. And we believe that there's that 91% of individuals living in congregate care have been vaccinated. Individuals in our system that live in a congregate care setting in Cuyahoga County. The direct support staff that support them would have also been eligible in that Group 1A Now there has not been as high of a rate of successful vaccination amongst the staff. I don't have good data about that, but we believe it's only perhaps in the neighborhood of 25 to 30% of people. In that group 1B, we received a list from the state of individuals that would qualify for 1B. That list had, I believe, about 2,700 people on it, and about 60% of those people have been vaccinated to date. As far as education, we have provided, we think, a fair amount of resources and material. We think, and this is somewhat anecdotal information, but we have reached out to every single one of those 2,700 or so people on that list. The reluctance seems to be kind of some long-term historical concerns about vaccines, perhaps past bad experiences with vaccines, and sort of a skepticism about a widespread governmental medical program. And so we think that education could help, but also it's just a matter of time. A lot of people just kind of are taking a little bit of a wait and see approach. They don't want to be the first ones. And so we're hopeful and optimistic that, in the very near future, many more individuals will go ahead and choose to get the vaccine.
Sharon, as we talk about direct service providers and direct support providers, they were so important in the reopening in July, and coming out into the public and coming into the centers and working one-on-one with individuals. We know that the Medicaid daily rate for DD services and those providing them is significantly less than the actual cost to provide comprehensive services and hands-on care. And even with organizations paying direct service providers more, many are barely making a living wage. So do you know what steps can be made to get direct service providers up to or beyond a living wage?
Well, first, let me say, we're at the county board here. We are also concerned about the idea that, we do seem to be on the verge of perhaps, reopening fully, and by being on the verge, I don't know exactly how long, but we're closer than we were a year ago at this time to that. And unfortunately, what we do hear also anecdotally from providers, we hope that you don't have a hard time staffing your programs back up so that you could accommodate if all 500 people do want to come back. That would be a really, just a terrible outcome to all of this if that should happen. And I suspect that's a big worry of yours as well. So that's something I think we should begin to start having more conversation about. But as far as the rate specifically, I do know that as part of the state budget proposal, the initial budget, would be the biennium budget that should be approved by July 1st. The initial budget put forth by the governor did not contain any additional funding for direct support professionals or for a Medicaid rate. However, the various provider trade associations or support groups did put forth a proposal for a 5% increase to the Medicaid rate in each of the 2 years of the biennium, so a 10% increase total, and that would be for all waiver services and all providers. So as part of the last budget, as you know, there was a rate increase in that 2-year budget also, but that was limited to homemaker personal care services. It did not include adult day supports, but this proposal does include all providers. So I do know that is out there on the table. There was testimony provided, I think, to the House Finance Subcommittee. It seems like it's been well received as far as being a proposal, but at this point, I wouldn't be able to really comment on whether or not it's going to get the kind of traction that it would need to pass. It's a big ask, but I think there has been a real appreciation for the fact that these folks are significantly underpaid and they work really hard. And I think another thing that we learned throughout the last year is that a lot of people in our community don't even know that these kinds of services take place and how crucial they are. And so I think, going forward, we all can work together to do a better job of telling our story, both for day supports and residential services. It's nice to be under the radar, but it kind of felt like we were too far under the radar. And so, nursing homes and the staff in nursing homes got a lot of attention throughout the pandemic. Our providers did not. And I think that was a lesson learned, and we can do better going forward.
Sure. And we certainly hope that these lunchtime sessions help shine a light on the services that are provided and why they're so crucial in our community. Laura, do you have any comments about maybe what the provider consortiums are talking about in terms of Medicaid rates and direct support providers?
Sure. Well, I will, just to comment on the last section there first. I would say that the direct support professionals were truly the true heroes of the pandemic for our services. There, as you said, there was talk of the nursing home, and many talk about retail and obviously healthcare. But for the staff who worked with individuals, not only residentially but in day services, they were the true the heroes of ours. So for us, I think the challenge becomes, how else can we help support the community? And I think that the consortium and other groups are talking about increasing and lobbying for those day rates. Specifically, one rate that is mostly talked about is group employment support. That is often a real crucial service that for individuals who are just moving towards competitive employment, they really need that support. They need that skill development and skill building. So there's definitely been a lobbying support with not only other provider Ohio associations, but the consortium itself to really kind of come together to focus on that service in addition to the others, as you mentioned, with the budget proposal, but that one specifically because it's often significantly lower for that crucial step for many people as they're moving towards competitive integrated employment.
Yeah, that was sorry.
That's okay. So as we look forward into the next year or the next 3 years, one of the things that the pandemic really showed us is that this virtual community is scalable in a large way, right? Unfortunately, that doesn't always pan out or is the case for individuals with disabilities. But where do you see services for individuals with developmental disabilities in the next year or 3 years? And what kind of space is there for virtual services or increased digital accessibility?
Well, from our point of view, so we have learned, just like you said, that the virtual visits and meetings, it is scalable and it has worked very well for many people. In fact, I think many of our families would probably say they prefer this, and it has for some people it has allowed them to access services or activities that maybe they would not have otherwise because of transportation concerns or regardless of the pandemic, they just couldn't get there for whatever reason. And so it at least allows for some participation. So I think from our point of view, we're going forward with our staff and our services, our early intervention services, our support administration services, our behavioral health services. We are going to be returning to in-person, that will still be the preferred way of interacting with people and planning with people and meeting with people, supporting people. However, this the virtual visit can supplement or enhance what we do in person. And so we could see people even more often than we do with part of it being through a virtual means. And so that's our approach, understanding that there may be some people who really prefer more of a virtual, less of an in-person, and that would be okay. too. So that's how we're approaching it. As far as waiver services and service providers, I think that that there absolutely could continue to be a use for virtual. And I know that there's talk that that STEPS program, which you know, I don't know if VGS ever dipped your toes in the STEPS program. No pun intended, I guess. But I think there were some problems with it or issues with it that providers didn't go down that road. But I think something similar to that is being talked about as becoming a permanent part of service delivery. And then the you know, related to that, we would just have to try to make sure that individuals served do have the equipment and the internet access that they need to be able to access those. And I think again, now that things seem to be headed in the right direction and we're starting to get back to some more normal times, perhaps that is a discussion that we could have on what can the county board do to potentially help with that effort for people who need it. And we do have ways that we can help. We have lots of loaning equipment that we can make available to people. We have you know, family supports program that people can access some of those things from. There's not really a one size fits all, but we have several different ways that we can help with that.
Mm-hmm. I will say from our from vocational guidance services standpoint, I think participation from family and caregivers has greatly increased because of the virtual options. You know, before, when we're planning and outcome discussions and the teams come together, oftentimes parents and guardians and caregivers had to take off work or have a, you know, later in the day to provide access. So I think that has helped just the participation. That's from the family side. And I think now that we're a year in, I think the individuals are starting to really adjust to it as well. I will say it's a little different on the employment side for our individuals who are seeking employment. Mm-hmm. But I think there's a greater comfort for many who are just continuing. I mean, it's virtual for services in many cases or not. So I think people are adapting quickly.
Mm-hmm. Right. So and if you only have 15 minutes, you could still Zoom in and check in with a family, and that could be very meaningful to them. Whereas if you had to make an appointment and get in your car and drive out to their home, you know, you wouldn't never be able to do that in a short period of time like that.
Right.
Yeah, and I know the data from the state VR services shows that the families actually really do appreciate the virtual capability and the ability to be a part of planning meetings and a part of all of that without having to worry about the transportation issue or the timing issue. Mm-hmm. We've talked about a lot of things here today, a lot of really important topics. And one of them that really caught my attention, Kelly, was this need to sort of shine a light on the services that are provided and why they're important, and the work that organizations like VGS do in conjunction with the county. So how do you think that the community can join and help? How can they support individuals with developmental disabilities? And what's the main way for them to support all of these services moving forward?
Well, I think the best thing that we collectively can do is for people to be seen in their communities. And it's a little bit contrary to what we've just been saying, that virtual visits and virtual services are easily accessible by people, which is true. But I think as more and more, as there's more and more ability for people to get out into their communities, we at the county board have I have a goal around creating some community-based services, recreation services, other types of services. And we know that when day programs were closed, or if for some reason when they reopened, if individuals weren't able to go back, we've also seen some creative work by residential providers or families about just taking advantage of things that are, right in someone's community in order to try to fill their days with meaningful activities and make for a fulfilling life. And so as things are reopening, recreation centers, libraries, churches, and can we really work to get people out into those communities so that they are, so that people in the community get to know them and perhaps get to know their caregiver or their companion that may have to be coming along with them. And I think that's how we start to get the conversation going. We start to get people to see that there are these direct support folks that support people with developmental disabilities to live life in a fulfilling way, and they provide a very important function, and they deserve to be, compensated for that.
Laura, I don't know if you have any comments on that topic in terms of other organizations and consortiums that are working together to raise awareness.
Mm-hmm. I think, we as an agency are members of many different consortiums and state and kind of national organizations. And I think that's always been a challenge. I think, as Kelly said, it's kind of getting that awareness out, but how do you start with that? I think, just providing opportunities to be in the community. But also, I think, advocacy is a huge part to spreading the word, sharing information. And I know that there's efforts with many of the different groups and consortiums that we are a part of. I think it would be helpful that we can continue to share that message. The more that we can, share information on Facebook and share information on each other's websites and continue to provide messaging and even opportunities like different continued lunch series to spread the word, to share the information and provide awareness is crucial.
And I certainly know from our perspective at VGS that we talk often and openly with board members and our community partners about the importance of the services that we provide. And when there's opportunities to contact representatives in either Washington or in Columbus, that we encourage that and facilitate some of that contact for them. And hopefully other agencies around the county are doing the same thing, and I'm sure they are.
Mm-hmm.
So are there any questions from the audience at this point? Okay, well, I want to thank both. The question is, are there any adjustments you made in providing services as a result of COVID-19 that you plan to continue even after we, quote unquote, return to normalcy?
Well, again, from our standpoint, we will be continuing to use the virtual visits for families that may request that or prefer that. Again, we feel strongly that, we still want to see people. We still want to get together in person whenever possible, or, if it makes sense to do that. But we think that using the technology can be a supplement to actually enhance or increase our service to people so that we could actually be seeing them more often than we do when we do it in person.
Mm-hmm. And then just from us as a service provider at Vocational Guidance Services, we're seeing a lot of decreased colds and flu, just like the United States, and really many because of social distancing, mask wearing, hand washing. I'm not sure that mask wearing will be, a thing in a few years, but I think this increased awareness of hygiene and personal hygiene, that's definitely one thing that we will continue to be very aware of over the next many years to come, of just making sure the areas are clean and sanitized, just from a true health and safety perspective alone. But again, I think there's also a time saver with some of the virtual services and virtual meetings. I think that's really helped for our staff focus on the quality of services rather than, having to schedule a meeting. It can be something quick, or if, they need to engage with a family member. So it's providing us new opportunities and I think continued opportunities.
Laura, that's a great point about the, sorry, Susie.
That's okay, go ahead.
That's a great point about the hand washing and sanitation. I think that's a real silver lining or, positive lesson learned from all of this going forward.
That's right. Our moms were always right. Wash your hands,
Yeah.
right? You know, I think one of the really interesting things about the technology and this new comfort level with technology is that it has allowed us to connect to our program participants in ways that we didn't before and in larger numbers. So by providing virtual connections, we've been able to invite our entire board to connect with the individuals who are in one of the centers. And that's provided an opportunity for people in the community to actually see how these services work and why they're so important, and how important it is for us to recognize individuals with disabilities and really support them. So I'm really excited about that. And I hope that that continues into the future, because I think it will be a way for larger numbers of individuals within the public to meet and interact with individuals with disabilities in a way that they've never been able to before.
Yeah.
I will say too, you know, we call those opportunities at the agency mission moments, and we have now a pizza party planned in July because of one of those mission moments. It's just, it's additional contact and additional awareness, and just, you know, it's fun too. You know, everyone likes to have fun and be social, but it's really, again, creating new ways and to bring people together.
Yeah,
So,
we've seen for our board meetings, which as a public body, we are required to hold public in-person meetings. But because of COVID, the statute was revised to allow us to do that virtually. And I believe it, well, it helps our board to be able to, you know, there might have been a few board members here and there that maybe would have said, I'm going to have to miss a meeting, but because it was virtual, they're able to attend. And then, but more importantly, I think there's been more attendance from just community members, our audience. Our audience is a little bit bigger, and it allows people to be engaged, whereas they may not have been able to come downtown at 5:30 on a Thursday, but they can log into Zoom and hear what's going on here at the county board.
sure. There's a question from the audience, Kelly, and it has to do with the county board receiving any funds from the American Rescue Plan of 2021 or from the state. Was there COVID dollars that the county was specifically given or will be getting?
So the American Rescues Act does include a 10% enhancement of federal funding for home and community-based services waivers. And my understanding is that it is not to be used to supplement current services. It's to be used to enhance or improve home and community-based services somehow. It's a large amount. And so, and it will be in place for 1 year from April 1st of this year through March 31st of 2022. As far as I know, it will not come directly to the 88 different county boards. We're still waiting for more guidance, but I do know that there's plans being developed about how those dollars might be used to enhance our system. But it would most likely be done as like a statewide, some kind of statewide initiative or initiatives. It will not be, you know, all 88 counties coming up with different plans for utilizing those funds. So that's a great question. But yeah, there is that 10% in that act, and it is a significant amount of funding that, you know, hopefully as a state and with the different provider agencies and the County Boards Association and the department, we can come up with some good uses for those funds.
Great. We look forward to hearing more about that.
Mm-hmm.
Any other further questions from the audience? This has been a really great discussion today. So thank you to Kelly and Laura for your time and your thoughtful comments today. It's been really a pleasure to have you with us. This is going to conclude our presentation for today. Thank you to everybody for attending. We hope you've learned something and enjoyed the presentation. We look forward to seeing everybody at the next one. And if you have questions or comments that you'd like to make, please feel free to reach out to us. And if it's not something that I can answer, I'll get the question off to Kelly and hopefully find an answer for you. So thank you, everybody. Have a lovely day.
Thank you. Thank you, everyone.
Thank you.